We do have one more guest with us, His Excellency Sri Madhuben Paudel, the Ambassador of Nepal to Kuwait. He is with us, and I would just say that you would give him a round of applause for his presence. Thank you, sir, for gracing this occasion. Thank you, sir. And now, I request Dr. Yusuf Al-Duwairi, the Assistant Under Secretary for Dental Affairs, Ministry of Health, to address the gathering.
Bismillah ar-Rahman ar-Rahim. Good evening for everybody. Ambassador of India to Kuwait, His Excellency Satish Mehta, Secretary to Dental Council of India, Dr. Lieutenant Colonel Oja, Dean of Faculty, Dr. Babani, KDA Secretary, Dr. Ismail, Chairman of Medical Association, Dr. Noteri. Ladies and gentlemen, my dear colleagues, good evening. At the outset, I extend my thanks to the Executive Committee and members of the IDEC for inviting me to be part of this event. MOH has always appreciated the contribution made by Indian dentists toward delivering dental care to Kuwait population. They have been of great help in improving the quality of dental services in this state. I'm very impressed with the community services provided by these alliances to Kuwait, and during recent years, IDEC has grown into a strong organization. It is very encouraging to know that IDEC comes out with their educational magazine for general public with Arabic and English once every 2 years. Dear colleagues, ladies and gentlemen, as two individual countries, Kuwait and India have enjoyed strong bond since many years, and this friendship is very deep-rooted, and strong services rendered by Indian dentists along with the activities of IDEC will reinforce this bonding between our countries. I welcome guests from Dental Council of India to Kuwait and wish them enjoyable stay. Finally, I'm really very proud and very happy to be here with you, my colleagues, my dear friends, and extend my best wishes to the committee and to all members of the IDEC, and look forward for more alliances in the future. Thank you very much.
Thank you, sir, Dr. Duwairi. Thank you so much for your warm words. We always appreciate your presence in every occasion. And now, we will have the address by Dr. Jawad Behbahani, the Dean of the Faculty of Dentistry. Please, sir, address the gathering.
Bismillah ar-Rahman ar-Rahim. Good evening. Ambassador of India to Kuwait, His Excellency Shri Satish Mehta, Assistant Under Secretary for Dental Affairs, Dr. Yusuf Al-Duwairi, Secretary to Dental Council of India, Dr. Colonel Oja, President of the IDAC, Dr. John Joy, KDA Secretary, Dr. Ibrahim Taqi, Kuwait Medical Association's President, Dr. Mohammed Al-Mutairi. Dear colleagues, ladies and gentlemen, my congratulations, Executive Committee and member of IDAC, for organizing an event like this. I admire the efforts of Alliance to get all the Indian dentists in Kuwait under one roof. I understand they have been actively involved in community services, which is commendable. This effort almost speaks of the quality of education received back home, which makes them work as a close towards a common goal. I'm very happy that note that the IDAC releases educational magazine and for general public with articles in Arabic and English, and I know very well that any editorial work requires plenty of time and effort. I congratulate you for your editorial for this publication. It is so good to know that they have invited guests from Kuwait, from Dental Council of India to let us know about their status of dental education back in India, which should be very interesting. I wish the guests a pleasant stay in Kuwait and looking forward to meet you on Sunday. In the end, my heartfelt thanks to the Executive Committee for all the members of IDAC for inviting me here, and wish you the very well and the best in the future. Thank you.
Thank you, Dr. Jawad. For those of you who know Dr. Jawad, he's an astute clinician who used to work, and he even works now. He's got very good clinical hands. And just so that a lot of people who read literature would know, those who have heard about Torab Ijdad, he has been associated with Torab Ijdad because he's been a graduate of Harvard University. Let's give a round of applause for him one more time. And now, I request the Kuwait Medical Association Chairman, Dr. Mohammed Al-Mutairi, to address the gathering.
Your Excellence, Ambassador of India, Mr. Shri Satish Mehta, Dr. Yusuf Al-Duwairi, Undersecretary of Dental Affairs, Dr. Jawad Behbahani, Dean, Faculty of Medicine, our distinguished guests from India, my dear colleagues from the Kuwait Dental Association, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. It gives me a great pleasure to present Kuwait Medical Association in participating in this activity organized by the Indian Dentist Alliance in Kuwait. After being in my post as the president of Kuwait Medical Association, and it was a recent post, I was invited to a couple of activities done by the Indian Doctor Forum here in Kuwait. And one of them was a medical camp done in a private school in Salmiya, where many Indian doctors, they spend their personal time and efforts in treating and seeing poor patients from the whole community. It was great effort, and in that meeting, actually in that day, I saw a great teamwork. I'm sure the Indian Dentist Alliance will do the same excellent work and maybe better. At the end, thank you for inviting me to this event and wish you all the success in the future. Thank you.
Thank you, sir. Thank you for taking your time and presenting yourself in gracing this occasion. And now, for the occasion for which we have all gathered, the Oral Health Guide release. I request Dr. Yusuf Al-Duwairi to officially release the Oral Health Guide and present the first copy to the Ambassador, His Excellency, Sri Satish Mehta. And now I request the editor, Dr. Charlene Simon, to address the gathering.
Good evening, His Excellency Sri Satish Mehta, Ambassador of India to Kuwait, Dr. Yusuf Al-Duwairi, Assistant Under Secretary, Ministry of Health, our guests of honor, Dr. S.K. Oja, Dr. Jawad Behbahani, Dr. Ibrahim, Dr. Mohammed Al-Mutairi, distinguished guests, and my fellow IDACians. It is indeed an honor to be standing here today as we celebrate the joyous release of the Oral Health Guide 2013. Let me take this opportunity on behalf of our editorial team to thank each and every one of you for having graced this occasion with your presence. I'm sure you will all agree with me when I say that dentistry is a very complex science. It's a healing science that uses cutting-edge technology. As practitioners of this healing craft, it is not enough to draw upon the wealth of knowledge that we have garnered from our dental schools. We also need to constantly tap into other branches of science and art to perfect the skills that we have learnt. As practitioners of dentistry, we ponder over the laws of physics. We wonder at how our teeth can withstand pressures of over 500 newtons while chewing and still not break under duress. We question how we can further improve the adhesion between the tooth and the restoration we place by improving the quality of the adhesives that we use. As dentists, we're also artists who strive to achieve and maintain symmetry, and we get all excited as we talk about hue, color, chroma, and saturation. We use technology to understand how the human mouth can host more than 20 billion oral microbes and still not succumb to deadly infections, as we dwell into the workings of the white blood cell and other cells of the immune system. Through the Oral Health Guide, IDAC hopes to educate the public on the complexities of dental care. Our initial volumes were focused on frequently asked questions and on understanding the basics of oral health. This year, IDAC chose to focus on a specific field of this vast science that we practice. Thus, this year, we chose aesthetics as the theme for this magazine. And in keeping with this guide, shines light on the handful of the current trends in aesthetic dentistry. We have elaborated on dental implants, laminates, bleaching, lingual braces, and depigmentation procedures. In our future issues, we hope to educate people that dentistry is a lot more than just 32 teeth. Dentistry is about an entire system called the stomatognathic system. It involves a whole range of complex fields like reconstructive, maxillofacial surgical procedures, orthognathic surgeries, periodontal plastic surgeries, facial growth modification, complex prosthetic oral and facial reconstruction, cleft lip and palate repair, interventional orthodontics for the pediatric patient, and the like. When I was called to don the mantle of being editor, I was weary of the challenges that lay ahead of me. But the one thing that I knew of was I was confident that there was an amazingly fabulous team that I would get to work with. And today, I hope you agree that we all see proof of the team that has worked with us. I would like to thank the IDAC Council for their constant encouragement and the faith that they placed in us, the editorial committee. To the authors who gave so freely of their time and expertise to put together articles in simple terms. May I extend my gratitude to our sponsors who gave so generously, and we are grateful for it. And last but not the least, may I take this opportunity to thank my team, especially Dr. Pramod Menon, without whom this book would not have seen the light of day. Once again, thank you all for coming, and I wish you all an enjoyable evening.
Thank you, Dr. Shalin. For those of you who don't know much about dentistry, it's not a big issue regarding small tissue, but it's about the mouth being the gateway to the body. If you don't eat, you don't sleep. So eat well, sleep well. And now, the second item that is to be released today, the Foreign Dentist Handbook release, a unique book in itself. I request Dr. Ibrahim Ismail Taki, Secretary Kuwait Dental Association, to officially release the Foreign Dentist Handbook for Kuwait and present the first copy to Dr. Jawad Behbahani. Dean of the Faculty of Dentistry.